Dr. Scott Morris here from Morris Consulting Associates. In today's series, we're going to talk a little bit about the future of the medical workforce. And when we think about that, there's always political debates on both sides. Are we training enough doctors? Do we have too many doctors? Are too many patients coming in? I don't want to get into that whole political debate, but what I do want to talk about really are what are some of the facts that we all need to consider as we look at the true future of the medical workforce. First of all, we're going to talk about really what are some of the factors in our current workforce. Well, I think it would be hard to argue that in our current system, we are very ill-equipped to handle what some of the major medical health challenges are going to be over the next decade or two. Things like environmental factors like obesity and smoking are going to have huge impact on our healthcare system and really are set to probably overwhelm what we currently do. Chronic diseases like diabetes and degenerative disease and things like dementia are set to pose incredible challenges to our system. So what we do need to talk about is, well, what are some of the factors as we look forward into the future that we need to consider? Well, one, this increased epidemic of systemic disease, or really chronic disease. Two, an increasing population. Our population is growing at a rate that we have not seen in many, many, many decades. Three is aging. And we have more people over the age of 65 currently than we've ever had in the history of this country. As that population continues to age and live at longer and longer periods of time, have extended periods of life, more chronic diseases are more than likely going to continue to occur and be things that we need to treat, and those people are going to seek care. Now, I guess the good news about this, we're going to have a tremendous increase in really what we call the technology advances that are going to impact our healthcare system. Things like big data and the use of artificial intelligence to help sort through all of this information and data to help us as physicians be able to make better clinical data and have better clinical data and make better decisions. Stands to be a huge improvement over the healthcare system we currently have. Granted, there are challenges, but still serves to be able to impact us in a great way. Hopefully in the help of being able to develop new models of evidence-based medicine and change in payment from really our cost per procedure model that we have now to much more of a value-based medicine type of situation or system as we look forward. We're also going to have increased effects of really what genetic testing and genetic modification are going to do, so we can start treating things as a preventative nature or a prophylactic nature instead of a reactive nature as our current system does. So without a doubt, there's going to be huge changes there. But we also know we need to face facts that there has to be a shift in the way cost is dealt with. We're going to see a much bigger movement towards care of a consumer or care of a patient and cost management of them than it is about the income of what the providers and the healthcare system can create or generate. So these are just some of the factors we need to consider as we look forward to this discussion about the future of the medical workforce. The next thing I want to talk about is really what are some of the problems that we're going to deal with our current workforce that are going to have an impact on what we do moving forward. So what are the problems? Well, I think we need to break it down into a couple different pieces. The first one we're going to talk about is provider demographics. We look at providers, and a couple problems that we see is, one, there are a lot less of them coming out of school, despite the fact we have an increasing population. This demographic may be very different than the current demographic that's out there. And we look at that and say, that's problem number one, is the people that are coming out. Two is what they're going into. And that means both these people that are coming out of school, our newer providers, are not going into the areas that need to be served, like rural areas or necessarily deep urban areas, but they're choosing to go in places that they want to go. Now, granted, as physicians, they have every right to do that. They spend a great deal of their life in training, and they have a huge debt, and they probably need to go where they want to go. But our system is a little broken that we're not providing care where we need care the most and having an excess of providers where we maybe don't need that excess. Now, the interesting fact is, if we look at epidemiological studies, we find that having an increased provider volume in a specific area doesn't always translate to better care. In fact, when we look at doctor to patient ratios, there's really no correlation between that ratio and outcomes such as quality measures, access, or even patient satisfaction. So we look at the provider demographic and say that's changed. We also know there's going to be an increased amount of job sharing as our providers of this generation or newer generations don't want to work the 40, 60, 8 hours a week that some folks in my generation and older generations have chosen to use as the way they work. There's going to be much more job sharing and life-work balance that come into play with this. And those aren't necessarily problems per se, but they're a reality as we look into the future of our medical workforce. Now, we know that adding more doctors isn't necessarily the problem. What we do need to do, the problem is having an increased integration of care. Now, that is going to be a huge problem as we look in our current healthcare system, say, how do we transfer from a really procedural-based systems to an evidence or a value-based medicine procedure? And over the next decade, we're going to see a lot of these changes. Some of them are going to be successful, some of them are going to be failures. We really won't know that until we look at it in retrospective. But our healthcare system will have to take these changes and have to take these challenges, even if they may fail, to try to advance our situation and go forward. Now, the second part of our discussion is, when we talk about the medical system and really the medical workforce, is our consumers. Our consumers, our medical consumers, which we often call patients, also are going to need to change their mentality. And it will be the medical workforce's responsibility to help with that manifestation of change. And the way we're going to do that is we're going to have to move much more towards a patient-driven or patient self-care situation. Much less of an entitlement problem that we deal with currently in both Medicare, Medicaid, and our third-party plans as well, but much more towards an integrated plan where the consumers are just as responsible as the healthcare providers for fixing our system. Now, without a doubt, as we look at some of these problems, we know that the challenge we have is we really can't project today's healthcare system into what the future is going to be, because the future is going to be very different. And what I really want to talk about now is, how is that future going to look different? Because that's going to have an impact on what we do and how our medical workforce is trained, prepared, and sent out into the world. So what is the future going to look like? Well, I definitely don't have a crystal ball, but I have some pretty good ideas of how really healthcare and the healthcare system is going to impact really the future of the medical workforce and what that's going to look like. So we're going to break it down into really things. We're going to talk about the impact of technology on the future. We're going to talk about the impact of the consumer, meaning i.e. the patient. And then we're going to talk really about the provider and the healthcare system as a whole, and how those changes are going to affect what we do with the medical workforce. So first of all, let's start with technology. I think that as we look into the future, we see that we've had huge advances in both diagnostic technology as well as therapeutic technologies that are out there in terms of medical device in the last decade or two, probably at a greater rate than we've ever had before. And we don't see that ever stopping. I mean, we'll continue to have a very innovative type of medical situation where we continue to build new technologies. But one of the most fascinating technologies that probably stands to have the largest impact on our medical workforce is the creation of artificial intelligence and the use of big data. You know, granted, we are still in the infancy of big data, but as we look to the future, the realities are there is no way that our current medical workforce can keep up with the amount of data that is being delivered to us every day. There's no way to read all the information and all the journals and all the online chats and all the web-based stuff that's out there to keep up our knowledge level of what truly is the most current and truly evidence-based medicine that's out there. And even when we look at evidence-based medicine now, not to go off on too much of a tangent, but most of that medicine, these studies are conducted by and or sponsored by different companies that have a vested interest in what the results are going to be. And we look for the perfect patient populations to do those studies on. In the reality, big data is going to take a look at N numbers of tens and hundreds of thousands and even millions of people to say, are there spots, are there areas of concentration, are there certain outliers that make people greater risk for one thing than another, that as providers in small practices, medium practices, hospital-based practices, we can simply not access or have information about. Big data will be able to help us do that. Artificial intelligence will help us sift through those things to find out truly in this particular healthcare consumer's situation, what are our likely avenues that we can do in terms of both diagnosis and treatment. So AI, big data are going to be a huge impact on the future as we look forward. Now, the second part about that is we're going to have a much better interoperable healthcare information technology than what we currently have. There are all kinds of things on chat lines about how poor our electronic health records programs are actually conversing and talking with each other. I will be the first to agree with that at some point we're going to have a national healthcare database that everybody can access. And of course there's all kinds of issues about safety and security, and we may have where there's one database that all the information sits, or maybe we all carry that information in a nanotech or a chip that's in our hand. I don't know which way the technology is going to go, but we do know that people are going to start having to be more responsible and have greater access to their health information, so we're not having replication, duplication, or unnecessary testing and treatment options that just simply don't work. Now, that technology is also going to have an impact on consumers, and it really already has. When you think about that, probably most consumers have a smartphone. They have access to a computer, at least most people in most developed countries. And that's changing the way medicine is being provided as we move towards more of remote diagnostic testing as part of what we do. I want you to think about the cost of, not to the system, but to the consumer themselves, to take time off of work or to take time out of their day or to find a caregiver to drive them to an office where they're going to spend a few hours many times to get a few diagnostic tests that with current technology we can do on a smartphone or do much in a much more, I should say, much less expensive way than current medicine allows us to do. That type of more current information and maybe more live time information stands to give us tremendous more information as we move forward about how to treat and diagnose our patients. Now, the good news about our medical workforce is many of our younger generation colleagues have been familiar and are very comfortable with using that technology than maybe some of the older generation providers are. They're much more accustomed to saying, let me integrate with this program and this program and this program to find out what the current information is. Now, advocates of this say, yes, that avocation or the ability to integrate different pieces of information is a huge positive as we look forward to the medical workforce. And without a doubt, it should increase and streamline what we do, increase the efficiency of our workflow. Many of the pessimists or antagonists will say, yes, but there is no exception or there is no substitute for training and experience. And granted, that's also correct. But we have to remember that many of our providers really haven't learned much and haven't kept up with what the newest technology is. And not that our newer generation providers will do any better, but they're more likely to access information that's out there on the Internet of Things in the future, or what we call the World Wide Web now, to be able to access that information, provide better quality, integrated, interoperable care amongst all specialties and general medicine. Now, the consumers themselves still continue to play a big role in our medical workforce. They're still going to want compassion and empathy and understanding, though maybe in a different way than what the healthcare consumers of the past have done. The newer generation is much more likely to do a virtual consultation that they can have live FaceTime with somebody than they are to say, let me go to an office where I'm going to sit and wait, and in an inefficient process. So that change in virtual technology utilization will have a big impact on the healthcare workforce. As they say, are we comfortable with dealing with our consumers from that perspective? And having that information taped, recorded, replayed, sent to friends, all of that type of stuff will have a huge impact on our healthcare workforce as we move forward. Now, of course, our healthcare consumers also are much more comfortable with technology in terms of looking up and doing their own self-diagnosis, which that may be good or bad depending on where they get their information and how they share that information. But what we hope in the healthcare system, the future, that this integration and sharing of information and analysis or I should say sub-analysis by big data will help us provide better value-based or evidence-based care across different spectrums of different diseases and different populations. Now, last but not least, as we look at the future, the healthcare system itself has to change. We talked about interoperability of healthcare information and integration of big data and to be able to focus and sift through all the mountains of data that's out there. But the systems themselves have to get more efficient. They have to become better at saying, let's give very specific focused care that's not focused on procedure-based income, but focused on true quality of care outcomes. And so as we see those things change over the next decade or two, we will make mistakes in our healthcare system. Our providers will continue to make mistakes in terms of how they share information, how they treat patients, and how they make diagnoses, just as we have for the last millennium or two of healthcare. We learn, this is why they call it the practice of medicine, that will not change. Hopefully it will improve, but it will not change. So as we look at the future of the medical workforce, I personally am encouraged and say we're at a time where technology may play a greater role in us providing greater, more efficient, better care to our consumers than we ever have. Yes, there will be mistakes. Yes, our healthcare system will try things and fail, and we will try things and we'll succeed, and hopefully more successes than failures. But that's the only way we can move our healthcare system forward, and the future of the medical workforce's impact on that will be monumental in terms of our ability and our willingness to adapt, to accept change, to move forward, to implement new technologies, to implement new information and new ways of doing things to make more efficient, better care. Hopefully you found this podcast helpful and entertaining and educational, and at least make you think about a few things that as we look at the workforce going forward, things we need to consider as both educators, as providers, as consumer advocates, all of those things to help make our system better. Thank you for your time.